that we have?
Well, I think we have to reject what we have.
Okay.
And most people agree with that. But almost everybody said what we need is total socialized medicine. And I don't like that because it doesn't work. And we've had too many examples of that. I mean, even in a place like Canada, which is not overly socialized, but their system is such where a lot of Canadians have to come to the United States because we have a freer market.
For example, the Canadians pouring across the border for care that they can't get in Canada. And we hear that a lot. Well, the only reason the Canadian system works at all is that they have a safety valve. They can come here. Well, the fact of the matter is that 90% of the Canadian population lives within 100 miles of the U.S. border. Canadians come to the United States for lots of things, mostly not for health care. There are some arrangements made with some facilities in some U.S. states that make arrangements with the Canadian province. So the sort of very obvious example is that people in Windsor, Ontario, who are right across the bridge from Detroit, Windsor's a small city, they need serious heart surgery, they go across the river to Detroit and have the surgery. The province picks up the bill instead of their having to go to Toronto or Kingston, which are hours away, or Hamilton, which are hours away, 4 hours away. So it just is a sensible kind of solution. So somehow that gets interpreted as Canadians pouring across the border. So if they can afford to, they get out. Lots of them go to Florida. They're seniors. They get sick. So they go to hospital in Florida. Used to be the province would pick up the whole bill. Now the province, I believe, depending on what province, will pay at the provincial rate. But typically what they'll do is negotiate with the U.S. facility before the Canadian ever has to see a bill. So as to Canadians pouring across the border, there was a nice study done in 2002. They looked at Washington State, Michigan, and New York and found that in 1 year, a total of 909 Canadians had sought care, 17% of those electively. 40% of hospitals on the border reported having seen no Canadians. Another 40% reported having seen fewer than one a month. A survey of 18,000 Canadians reported that 90 had received any care in the United States and only 20 had sought care in the United States. The notion that Canadian healthcare professionals, particularly docs and nurses, are streaming south to work in the United States is also not the case. It's a trivial amount. There are some doctors who come to practice in the U.S. There are some American doctors who go to practice in Canada. In the last couple of years, that the balance has been on the negative side. That is, more docs returning to Canada than leaving Canada. They'll come south and practice for a few years because they can make somewhat more money here, and that's very attractive. Likewise, nurses. And then they run home screaming because they just, you talk to Canadian healthcare providers and they say, they use words like obscene. The notion that you would ask a person whether they had insurance before you would treat them was obscene to them, was truly offensive to them professionally and from a humanitarian standpoint. If you get sick in Canada, you'll be treated, no questions asked. At the end of your treatment, somebody is likely to come up to you and say, "Excuse me, I really hate to ask this question, but do you have any kind of health care insurance? We don't like to ask, and don't worry about it. We'll make an arrangement." But because they just hate bringing this into the healthcare transaction, they hate it. They have to, because we frankly would bankrupt their system. The province of Ontario had to issue picture IDs because they found a lot of Americans were coming into the province and taking their friends' IDs and getting free health care on the province. And of course, not living, working, paying taxes there. There's 10 times as many of us as there are of them. We could bankrupt them in a week, right? If we all, and you'll hear, sometimes people will hear about healthcare in Canada and they'll say, oh, it was Jay Leno said last year, I've got a solution to the healthcare crisis, marry a Canadian.